Welcome back to the Nursing Edge podcast. I'm Dr. Milady. We're here to discuss today, after we have discussed many different things about anxiety, how to beat the fear of getting started, being resilient, thinking of the things that we've done in the past that we have overcome to be able to start something new, where to find the funding, where to find the money. If you have not seen these videos, please, I would refer you back to my previous videos to see about how we get started and getting to this point. So today we're talking about how do we get started? The application. How do we get in? That's the dreaded thing. And getting into nursing school is highly competitive, as you may know. There are a lot of people applying, but what really sets those people apart? So we're going to talk about several things. The first one being, in this area, it's been a long time for me for nursing entrance exams, but I've had to learn about what's going on for this side of town. And I am in Houston, Texas. And what the entrance exam that is being used is the HESI A2, and it is the Health Education System Incorporated, where it is an entrance exam that really tests your readiness to get into nursing school. And it tests reading, vocabulary, grammar, math, biology, bit of pathophysiology, or anatomy and physiology, not patho. It tests chemistry, and I mentioned math already. It looks at conclusions and implications and critical thinking skills. So again, all these things, you need to be able to understand what you are learning in nursing school and to be able to survive the education part of things, to be able to practice and be safer. So there are many resources online, unlike way when I was starting. Right now, the resources are in abundance. There are people doing videos online teaching about the HESI A2. There are people putting flashcards, different things you can buy on various media that you can purchase and listen to lectures, listen to various tips and skills to be able to pass the test. Different areas, different sections that you may, let's say you are stronger in one section, you don't really need much help in math, but you're able to get through. So you jump to maybe the reading, grammar, that sort of thing, or vice versa. I have seen just condensed cards that have the various sections of this exam. Now, in anything, the higher you can score, the better, right? I believe the average is anywhere from 75 and higher. Of course, 80 and higher is always going to be preferred, or the highest is always going to be preferred. So that's not the only thing that they look at in terms of application, but definitely scores, just like when you were in high school, SAT scores and ACT scores were extremely important as part of your application process. Some schools may require a part for you to take the HESI A2 at a particular time. And again, other schools, other states may not have HESI. I'm not 100% sure about that. I know I was in the Northeast when I got started. That was completely different in Connecticut. They didn't have HESI back then. So it's something that you always want to be aware of, the schools that you're applying to. What are the criteria for the application process, and make sure that you have everything in line before you get started. Deadlines, let me say again, deadlines are extremely important in any application process, and especially in nursing. There are no exceptions when it comes to deadlines. They say get it in by January, whatever. You need to make sure yours is in a couple weeks before in case there's issues with mail, weather, whatever it may be, that yours is in. You are most likely allowed to retake the test. I think most, allow you to retake the test. There may be some time in between that you're allowed to take it. They may say, okay, you may retake it 6 weeks, or they may say that during the application process, you can only take the exam twice. And then, if you don't pass it or you don't do well, then you have to wait until the next application process. And if you don't pass it, I highly recommend that you go back and restudy, see where the areas where you did not score very well, and then get some help, whatever help is needed. You may have, for me, growing up, I had my brother who was very, very good in math. Some parts of math I loved. Not everybody's very good in math. I needed some help growing up. And then once I got to college algebra, somehow that clicked for me. But the other stuff, I needed help in. I'm just being real here. Not all of us are great in math. And many of us may find math intimidating. And then other things are not. I was the reading and writing person. English was my thing and history was my thing. Moving along. Taking the HESI A2 for this area, and it is about a 4-hour test. So again, if you've taken the SATs, you're kind of familiar with that kind of a setting to take exams, and also being able to be in an exam hall for 4 hours. And we talked about other states and their entrance exams. Find out the application requirements. Extremely important. Again, I have many people coming to me they're trying to get into a nursing program, and they come in for their physicals, and then they'll come in for the physical without bringing to me the application requirements that may also have vaccines that they need. Now, sometimes we're going back and forth, and I'm saying, listen, I have done this for many, many years, and I know outside of just a physical form, you need vaccines. So your vaccines need to be up to date, especially your hepatitis vaccines, your hepatitis B especially. They're also checking for hepatitis C antibodies, so those need to be done. And they need to be, for most nursing schools, they need to be the quantitative. And it's not just a negative or positive. It needs to show how immune you are to this virus from either you're being vaccinated, right? Well, it's typically being vaccinated. And if you're not immune, some of the schools require for you to either get the vaccines. And if you're crunching for time, that's where the problem comes in. You need to make sure that you are able to get the vaccines from where they may have a fast track that you're able to do. Certain vaccines, like hepatitis B combination, may be fast track. And if you're not able to find that, well, are they going to allow you to have one vaccine, or can you apply with 2? By the time you get in, you'll get the 3rd. So hepatitis B is a 3-shot series, right? So the other is, many of us sometimes cannot find our vaccine records from when we were kids, or something happened where they were destroyed. They were like in Hurricane Harvey. That happened to a lot of people. Important documents, because we weren't expecting all of this to happen. So important documents were not raised up high. And even if they were, some of them, the water got all the way to the 2nd level of their houses. So a lot of those were destroyed. So we have to either find a way to get those vaccine records. Sometimes your past schools, your high school, may keep them on microfiche. Well, that was back in the day. They keep them online somehow. I'm not entirely sure. But for back in my day, it was microfiche. Y'all remember that, right? It's called all antiquated now. I'm dating myself. But we do keep those. They do keep the records for a certain number of time, and you may have to request it. There's a whole process with that. So you have to also keep all of that in mind when you're thinking about your application process and dates. I will repeat this again. There's no exception. Make sure you get your stuff in on time, and make sure you start the process very early and keep your dates in place so that you don't miss the deadline. Most of the universities, even me for my doctoral degree, use CastleBranch. CastleBranch is it's like a nursing hub. And I don't know whether it's just nursing, but it is a hub where the universities use to make sure that all the documents that need to be uploaded into the system or the school has a place for you to upload it. And you create an account on CastleBranch. If they need any kind of urine test, they will also have you sign up for something or go through CastleBranch. Some employers also can use CastleBranch for drug testing and such things. So CastleBranch, for most nursing schools, you need to make sure you have your tetanus, your Tdap up to date. Tdap is good for 10 years. And in terms of the medical aspect, we can talk about that if somebody has had stepped on a nail or something in the last 5 years. If it's been less than 5 years or more than 5 years, different things for Tdap. But for school, it's 10 years exactly. If your Tdap is about to expire as you're in nursing school, I highly recommend you get another one, because by the time you get in there and things are getting started, and you may not realize it's about to expire. In CastleBranch, once you put those dates in, those documents in, they're approved, they let you know that this is about to expire in such and such time. They keep sending you emails. And if you miss all of that because you are busy with school, and then this time lapses, guess who may get a letter that says that you're not able to return because of XYZ. So they make sure that you are the person who's responsible to make sure that all these documents are appropriate, and also that they are timely and they're not expired. Okay. Other things that nursing schools require are Mantoux skin test, which is a way to screen for tuberculosis, whether you have come in contact with tuberculosis. Some of them require 2-step testing where you get the skin test, which is called, many people know it as a PPD. You get the test done. It is read in about 48 to 72 hours. And if you wait to 73 hours, you come into my clinic, right, or any provider's office, you see a doctor, nurse practitioner, or PA, and they implant the test under your skin, and it creates a little bubble. And if it is negative and red between 48 and 72 hours, they will give you a paper documentation that states that all is well. You're able to submit that into your school or CastleBranch, whichever system you use. If you come back 73 hours, right, and we specifically said 48 to 72 hours, 73, it needs to be redone. I repeat, no exceptions. It needs to be redone. The test is no longer valid. The time has lapsed. Okay. So you want to make sure you get that done on time so you don't lose your money. Insurances don't really cover PPD testing. Okay. So the other is, I'm trying to think of, and when you get that test done, please do not scratch it. Please do not put soap over it. Please do not put like rough clothing on that you may be scratching, like cashmere or anything like that, because that may falsify the test, may make the area pretty irritated. Don't put any lotion on it or anything like that. Perfume. Typically we mark it so that you know exactly where we did it, and then come and get it read. I'm trying to think of some other things that I've seen in clinic. So we look at, sometimes it's not just, we don't look at just redness. We look at end duration, how raised it is. That is the positivity that we're looking for, and how big it is, how wide, right? We have specific calipers that we use to measure that. So just because the area is a little red, because some of us have very sensitive skin, anything that pokes can do that. The redness is not alone what we look at. Okay, we look at the raisedness, the enduration, and then we document that and give it to you. Some schools don't really want the PPD, the skin test. They want QuantiFERON TB gold test. Some of them feel they want that to be the gold standard, and it is the gold standard for testing for the bacteria, Mycobacterium tuberculosis. So that, again, insurances don't cover, y'all. And that test can run anywhere from $50 to $100 or more, depending on places that you go to. So you got to be ready financially for that as well. And once that test is done, it is a blood test. Your lab is drawn, sent out from most labs. I know for LabCorp and Quest, average of 5 days from the day that it is drawn, 5 business days. Okay, so again, with timing, you want to make sure you keep an eye out for that. Let's see what else. So the QuantiFERON TB Gold test has a 94% sensitivity and 97% specificity. So it is considered the gold standard to test for TB, Mycobacterium tuberculosis. And again, I'm going to say, make sure that all your documents are in on time. I think the major reason that frustrates people from applying to nursing school is that they didn't get the paperwork on time. They didn't get the physical done on time. And they told them that to get this thing in, or to get them into CastleBranch, and you're coming into the clinic, this thing is due tomorrow morning, and you want me to stop everything to do this physical. Listen, y'all, you know me. Those of you who know me, I'm disciplined. Get it done on time. And sometimes I'm able to, squeeze you in there just because I know how important this is. But most doctors' offices, as y'all know, most nurse practitioners like myself, most PAs and different offices, they're very busy. So you may not be able to get in that day to get something done. So make sure you know your deadlines. And let's see, what else do we need to talk about? So in doing all of this with the application, I say always do your best, be prepared, research. You can't go wrong with making sure that you know what's coming so that you're not shocked on a test or anything else. At this point, if you are looking into getting into nursing, you have taken many tests in your life and in your lives. And test anxiety, of course, is always a part of every test that you take, even walking into a new place. Some anxiety, like I said, is can be very motivating. You want to make sure that it's not crippling. The anxiety is not something that's going to keep you from moving forward and taking the next step. So once you do get in, right? Getting in, once you get in, you get the great scores, you got everything in on time, all your paperwork, all your documentation is great, you get that wonderful letter. It is amazing. It is exciting. I still have that letter to date. Can you imagine? It's in my little treasure box, things that I shall show my grandkids. I don't know, they may not be interested, but it's one of those things that when I am fully retired, I'll be looking through. It's like, wow, this is where we came from, right? So exciting stuff as you are advancing your journey from I'm thinking about it to I am applying, and then now I got into nursing school. So extremely exciting. And this is the same for anybody who has applied from being having an associate's degree in nursing and also going to a bachelor's degree and getting into that school, or going from bachelor's degree to master's or doctoral program, right? So it's all exciting, and I look forward to hearing from all of you and letting me know when you got your letter. How old were you? What were you doing? Where were you in life? The exciting things that happen, that we want to celebrate. We want to celebrate the wins. I'm all about celebrating the wins. And then what's the flip side? What happens when you don't get in? So if you do not get in, you got the letter of, denial that, you did not get in. Do not despair. I urge you, do not despair. The process, all the stuff that you got into CastleBranch is most of it. Oh, I forgot to mention, along with the requirements, your BLS is also required. I correct me if I'm wrong, whether it's CPR or BLS. So all that is required. The school will tell you specifically what is required. You don't need advanced life support yet. You don't need ACLS until you're, in specific settings and typically hospital settings. But all your requirements need to be in place. But if you don't get in, let's get back to that. You don't get in. So what do? You don't despair, because you are not the first to not get in. You are not the last. And I urge you to get back on that bike, get back on the horse. Don't let this discourage you. Again, as I said previously, sometimes God is sparing you from something that in the moment you're not ready for, that you think you are, you really want it, but you're not ready for it yet. And it may be another season in your life that you need to retry again. Keep trying. It may just be this moment. There's something that's about to happen that is going to overwhelm you, right? And he's sparing you from something. Or you never know. It's just different situations that may come up. There are many things that I wanted to do, but was not the right time. And I just have learned over time with age to heed the voice of God, to listen when I'm not supposed to do something yet. And it's okay to take a step back and to take a giant leap forward when the time is right, right? So go back and look at your exams, look at the HESI exam, see where you went wrong, see where you have deficiencies, and get some help, get somebody to help you out. And look at those videos. There is YouTube University, y'all. Just like now, I'm out here talking to you and giving you tips on how to apply to get in, to just motivate you to get into this field. There is a video for everything. YouTube University is what I call it. Social media, whatever it is you use, whether it's other social media platforms. But there is something for everyone. So you can look up. I said that if I had YouTube University when I was younger, y'all wouldn't see me here. I would be somewhere, way up somewhere. I'm just saying. I would have taken advantage of that. And even when I didn't have it, I was at the library, y'all. I was looking up information for scholarships, as I mentioned in the previous videos. I was digging through. I was taking notes. My Saturdays were spent at the library. The librarians at Norwalk Library in Connecticut knew me back then. So once you are hungry for something, nothing is going to stop you. You're going to keep going. I mean, God is the only one who can stop you. And the only other being outside of God is you who can stop you. So keep going. Do what you got to do. Be encouraged. Motivate yourself. You don't need anybody but you. You motivate yourself. You get up and you say, you know what, today I'm going to do this. I'm going to do the next thing and the next thing. Regroup, get back on it, and do what you got to do. So I thank you for listening to me today. And I pray that you are motivated to get back on the horse, get started, whatever it may be, get your application in and research, do what you need to do to improve your life and the lives of those around you. And please check my other videos that may come up over here on YouTube as they optimize whichever video. And we'll see you on the next podcast. Thank you so much.